My name is Dr. Gregory Hanker. I am an orthopedic hand surgeon at the Southern California Orthopedic Institute. And for the past 27 years, I have been specializing in the treatment of arthritis that affects the elbow, wrist, hand, and finger joints. Today, I will be discussing a very common arthritic condition that affects the most important part of your hand, your thumb. What is arthritis? Arthritis literally means inflamed joint. The smooth cartilaginous surfaces of our joints that fit together as a matched set become irregular and grind against one another. In effect, the joint wears out. The arthritic process can affect any joint in the body, but is commonly seen in the fingers, thumb, wrist joint, neck, back, knees, and hips. Arthritis in our hand and wrist can be both painful and disabling. There are many different types of arthritis, all leading to joint destruction. Osteoarthritis is the most common type occurring in the hand and wrist. It often develops as a consequence of a traumatic or repetitive injury to the joint. Since osteoarthritis is a degenerative joint disease, the result is destruction of the joint. The joint basically wears out. Osteoarthritis will result in pain, swelling and stiffness in the joint, and diminished strength. It commonly occurs in the base of the thumb and the wrist, where the thumb and the wrist come together, the end knuckles, and also further up in the wrist and forearm. The arthritis can occur in both young and old folks. In younger patients, it's often the result of an injury, such as a fracture or a severe sprain with torn ligaments and an unstable joint. In older patients, it's the result of years of wear and tear on the joint. Certain occupations that subject the joints to repetitive trauma predispose us to osteoarthritis. This can ultimately lead to significant long-term disability if it's left untreated. The patient's clinical symptoms of pain, swelling and stiffness in the joints, coupled with my physical examination of the hand and wrist, allows me to determine the extent of the joint degeneration. X-rays will also show the common characteristics of osteoarthritis. On occasion, MRI is also used as a diagnostic tool. In women, there's a gender bias. After age 55, the occurrence of thumb basal joint osteoarthritis is 9 times more common than in men. In young men, wrist and hand arthritis from injury due to trauma is very common. Well, the treatment for osteoarthritis is designed to relieve pain and ultimately restore function. Initially, conservative medical management of the arthritis is the treatment of first choice. This consists of medications, oral, topical, and injectable. Anti-inflammatory or other analgesic medication may be of benefit in relieving joint symptoms. Joint support with braces, splints, and compression wraps can also lessen pain. Adaptive aids and assistive devices can diminish the stress placed on an arthritic joint. Cryotherapy with heat or ice can be helpful. It is critically important to maintain motion in the fingers and to use the hand as productively as possible. To assist with this goal, hand therapy is often helpful. An occasional cortisone injection can provide temporary relief. These medical management treatments do not cure the arthritis, but they can control the symptoms. When the patient's pain becomes intolerable and their hand function is extremely limited, it is time to think about surgical intervention. The ultimate goal of reconstructive surgery for the treatment of arthritis is to eliminate the joint pain and to restore the function of the hand and wrist. Specifically, in the arthritic thumb basal joint, reconstruction with a tendon interposition or a suspension arthroplasty will restore excellent pain-free function. It is actually the third most common joint replacement. Other surgical options are custom tailored to the particular joint involved, as well as the specific needs and activity levels of the patient. As a hand surgical specialist, I can help you decide which type of surgery would be most appropriate for you. Please contact me at the Southern California Orthopedic Institute for your personal hand surgical consultation. I can help you eliminate the pain and suffering associated with your hand and wrist arthritis.